Hi, my name is Ashley Simpkins. Today we're going to be demonstrating how to do a sterile dressing change and to don and doff sterile gloves using our GPSB guidelines, our 11 rights, and our 3 checks. First thing we're going to do is knock on the door, enter a patient's room, and get the 2 patient identifiers and match that with their band. We're going to go ahead and do hand hygiene and assess the patient for allergies. We've already assessed the patient for pain earlier, and we administered their proper pain meds per order, and we came back, and now they're saying that their pain is a 2 out of 10. So we are okay to go ahead and start this dressing change. The first thing we're going to do is our hand hygiene, and we're going to don on our first pair of gloves. And we're going to begin the process of removing the bandage using our push-pull method, loosening the edges first, and using sterile saline if needed. We're going to pinch the bandage from the center and remove that, and then we're going to assess it using the taco method, trying to note if there's any type, what the type of drainage is, the amount, the color, and the odor. There's no abnormal findings that we're seeing here, so we're going to go ahead and dispose of that bandage. We're going to perform hand hygiene, and then we're going to assess the wound for size, appearance, drainage, and pain. Everything seems to be okay. So from here, we're going to go ahead and do hand hygiene and set up our sterile field. Now we've already checked our packaging. Everything is dry, unopened, and non-expired. So we are okay to go ahead and set this up. We're going to open our package towards us, making sure not to get into that sterile field. Hand hygiene again. And we're going to open up our first package of sterile gloves. Making sure to only touch that 1-inch border. We're going to go ahead and open these up. And using our forefinger and our thumb, we're going to grab the cuff, straight up, back and away. And we're going to don our first glove. We're going to scoop under, straight up, back and away, and don our second glove. And we can fix the cuff with the other sterile glove. Okay, from here we're going to go ahead and clean our wound. We're going to get our cleansing swab sticks from our kit and making sure not to go over the wound. We're going to go from top to bottom and disposing of each swab between. And then you're going to go top to bottom, down the center. From here, you're going to get some gauze and you're going to pat dry using the same technique, going from top to bottom, disposing between each dab, well, each wipe. Pass. From here, you're going to go ahead and dispose of these gloves and clean this sterile field. Hand hygiene, and you're going to don your second pair of sterile gloves. Again, making sure to only touch that 1-inch boundary. And index and thumb up, out and away. Scoop, out and away. have. We're going to go ahead and place our new bandage on top. We're going to add tape. And at this point, we're going to doff these gloves. Perform hand hygiene. And then we are going to go ahead and label this dressing with the date, the time, and your initials. And then we are going to go document our findings per hospital policy. And we will leave the patient with their call light, their bed in the lowest position, and we'll assess for pain after the whole wound dressing and hand hygiene, and we're going to close that door for privacy.